And would you use Nigerian healthcare facilities?
You know that we have limitations. We have been talking about those limitations.
We have university hospitals. If it means putting money in private ones, I'll put money there. But all of us must be treated here.
You see, this idea that our leaders developed over the years, that even when they have malaria, they will travel abroad, that shouldn't be acceptable.
The first thing you need to do with is the issue of primary health care, because that is the basics. And that, dealing with that, first you need to increase the investment we have today in health care. Again, let me give you an analysis. Like I said, in education, it's very low. Our total budget in the past 6 years for health is about 250 billion naira. That is totally, for a country of 200 million people, that's totally unacceptable. Especially when you need to deal with the issue of primary health care, and especially in the north, where we now have, now we've passed India, a country of 1.4 billion in infant mortality. And the reason why we passed them is because of the situation we find ourselves in the north. Because of not investing in education and not in training, we can't get the pregnant women and everything to follow, going to hospitals, going to this. So we need to invest in primary health care and first increase funding, invest in primary health care, invest in training the manpower. There's no reason why we should not have, especially now, nurses and midwives are needed all over the world. There's no reason why you should not have school of nursing or midwifery in every local government and be able to train the manpower that is required for this and all that. For what I can call the secondary medical care, what you need is insurance. When you come to the issue of insurance, there's a way you structure it that the government will also contribute. These are areas where you have to do subsidy, not in petroleum consumption. There's areas where government do subsidy, and it's in productive and development areas that are critical, like health, education, fighting poverty. These are areas you need to invest. So there needs to be a fiscal package to support this in order to support the insurance and everything, which will allow them to treat from high to low. It's been done in Indonesia, it's been done partly in India. I can show you big nations that are practicing it. We don't need to invent the wheel. We just have to learn what is being practiced somewhere and do the same thing. We have a country called Indonesia. There are 265 million people. They are providing health through insurance, where poor people are paying little or nothing. The rich people are paying more. That is happening in India, where they have 1.4 billion people, the same insurance. We will do it here.
We have a national health insurance scheme, which we established in this country, which is supposed to cater for every Nigerian. But unfortunately, because of our level of education and lack of enlightenment, not many Nigerians subscribe to the national insurance scheme. But we have. We were the first government to set it up, and it still exists, and it works. All what we need to do is that why is it not covering the majority of the population of this country? From rural to semi-urban to urban and also to cities. First and foremost, let's deal with medical challenges at the lower level. Basically, what is required is basic health centers to cater for the greater population of our people. I think this is where we need to focus as far as the general population is concerned. And I think we are not investing enough as a government as far as that aspect is concerned. And the second level is the medical tourism you are talking about, which thousands of Nigerians go out to receive. Here, we really need to sit down with the private sector and say, look, we want you to invest in healthcare, and we are prepared to give you incentives. What type of incentives do you want? It requires a dialogue with the private sector, because basically it is even those who go outside. They don't go to public hospitals. They go to private hospitals. So if we give the private sector the incentives they need to build hospitals, tax-free, this free, this free, this free, that free, for a number of years until you recover your investment and you make profit, I believe the private sector is going to come up.
Well, directly to medical tourism, I believe there are two things to be done. One, we need to put our house in order. We have to improve as government our facilities. All our health facilities at the university level and so on, we have to do whatever we can to provide all what it takes to conform with the international best practice, to build the confidence in those health centers and, of course, teaching hospitals. We encourage, say on the same side, encourage the private people who have got interest in establishing hospitals, give them all the incentives to do it, to establish the hospitals. But on the other hand, I think leaders should lead from the front, not from the back. You see, this idea that our leaders developed over the years, that even when they have malaria, they will travel abroad. Some of them have even chosen particular countries. Some have chosen Britain, some have chosen France, some have chosen Dubai, and so on and so forth. That shouldn't be acceptable. And I think these are things that we have to tackle from both sides, the quality of our facilities, right. And of course, the leaders must lead by example. Now, the issue of health insurance is very important and very critical, especially at this moment when Nigerians are finding it even very difficult to eat. Insurance scheme is so important that not only government should set it up, but it should be looked into. We are going to bring a lot of reforms to strengthen the health insurance in this country, so that as many people as possible can benefit from that. If possible, we make it almost everybody going to the hospital without necessarily carrying money with him. And that's when we also thought of these accidents and people going to the hospital as a result of either the accident or other sources, where police must be consulted before they are treated. All those things were being very much tackled by our blueprint. On the issue of brain drain, our policy should be to train as many Nigerians as possible. Of course, we'll encourage people, especially specialists, people who have specialized in some areas, to come back and work for our country. But of course, we'll continue to encourage Nigerians and train them so that they can work in the Nigerian market, and also if they have opportunity to go out of the country, they will be free to do so.